that's my cry and my credence, is to try to just get providers to understand that there's things that we can do, and parents for that matter, things that we can do within those first couple weeks that, yes, it's speeding up the timeline, but it's also making sure that the athlete is in the best possible scenario to come back on the field safely and effectively. And I think that that's my process, is just like answering those questions, and then brutal honesty. That's the other thing that I just will make my
Yeah.
claim. If you ask any of my patients, my athletes, they'll say he was very honest with me. So we learned something called informed consent when we're in school, but then when we get
Done
into
an
practice,
episode
the
on
first
that.
thing that goes out the door is informed consent. Doesn't
Yeah.
matter again where you're at.
Mhm.
And
Yeah.
informed consent means you need to present what's the diagnosis,
Yeah.
what's the possibilities, what's the downstream effects of that, what the intervention can do and it can't do, and then let the patient decide of what's next.
Right.
I've had some athletes and parents just say, "We're just not up for that."
Yeah.
Totally fine. If you
Right.
don't want to, that's
Mhm.
totally fine. Here's my suggestion. If you don't want to do any treatment, then here's what I suggest you do going forward.
Mhm.